Hello, everyone. Welcome in. Welcome. Luz is keeping an eye on the attendee list in case any panelists entered through the attendee link. So just so y'all know, there might be some late folks to our panel, but I'm excited to be here and we can go ahead and get started. So welcome, everyone. This is our second panel. Penny's here, fantastic. This is our second panel of this conference, organizing for decarceration. The panel we had yesterday was really amazing. For anyone who missed it, there will be a recording out. I'm looking forward to this conversation that we're going to have today. And we have panelists joining us from around the country. So we're gonna go around and introduce ourselves. And I'm gonna ask for folks to give their name and pronouns, the work that you do. If you are part of an alternative program to calling the police, let us know its name, how long it's been around, and a short mission statement of sorts. And I'm gonna paste that into the chat so that y'all can prepare for that. And I'll go ahead and start. So hello, my name is Tere Zorich. I use any and all pronouns with respect. I am a multidisciplinary artist and a student of abolition and transformative justice. I currently work with the network as the training coordinator of the Centralized Training Institute. Anyone who would like to introduce themselves next, please do so.
Hello, good afternoon. My name is Vero Ortiz. I am the Director of Clinical Services with Brighton Park Neighborhood Council. We are an agency in the southwest side of Chicago, and we provide services to the community in different areas, and I oversee all of our therapy services that we provide. I'm also a member of a collaborative called the Collaborative for Community Wellness, and our focus is about mental health equity and really ensuring that all folks in Chicago have equal access to mental health support. And through our collaborative, we are working on a program called Treatment Not Trauma, which I'm very excited to talk to you guys about today, that is really focused on removing police interaction in mental health crisis. Thank you.
Up next, my name's Swifte with CAHOOTS in Eugene, Oregon. CAHOOTS stands for Crisis Assistance Helping Out on the Streets. We are a program that's been in Eugene since 1989, and we're a part of a clinic that's been around since 1969. Outside of my role as a crisis worker and a medic and EMT with CAHOOTS, I'm a community organizer for housing justice through decriminalizing poverty in our area.
I was waiting for Penny, but I'll go. My name is Colsaria Henderson, and I'm a social worker. I now work for an organization called Center for Excellence in Nonprofits. I'm a senior leadership development specialist, essentially providing capacity building for folks, specifically also focusing on BIPOC organizations. I am, but my background is in 25 plus years of intimate partner violence and sexual violence work, including previously being from the ground up to an executive director of a large organization in Northern California. So I'm located in the Bay Area. I'm also board president for our statewide coalition, the California Partnership to End Domestic Violence. And we work really on the macro level is where my focus has been for quite some time, and to focus heavily on what are the systems responses and how can we shift system response for violence in our communities, for intimate partner violence, of course, sexual violence, and also community and state violence. So really looking at systems level interventions, and I also do some policy work in the state as well. So I'm really excited to be here, and I'm happy to hear from all of you.
I'm Penny. My pronouns are they and them. Thank you for letting me go last because I was putting together what I was going to say. I don't nearly have as many credentials as anybody else here, but I am a survivor. I do identify as a survivor, and I work with the CAT 911 sexual and interpersonal violence sector and various mutual aid networks around the country, organizing for healing justice action and survival programs through community-led projects.
Welcome, everyone. We're going to start with our first question, again, putting it in the chat so people can look it over. There is often a power imbalance in the ways that the nonprofit industrial complex versus grassroots coalitions formed by community members approach care provision. How can people working in social work build solidarity and coalition, not only amongst other nonprofits, but also with community grassroots movements? And I'll open this up for anyone who'd like to take it.
I know that awkward silence is therapeutic, but I'm going to jump in. So I think in my experience, and I've been a clinician most of my career, just moved into organizing, but we have a habit of working in silos in our work, and we often as nonprofit organizations approach it like, I have the solution, come to me. And I think we need more collaborative spaces, right? Coalitions that include policymakers, that include community members, that include service providers, right? We need to have all the minds at the table who can inform these policy changes and programmatic changes in the community. Because, you know, and as nonprofits, we just don't have the resources to pull into the amount of manpower that we need, but we know that we can pull from other resources, and if we work together. And I've been a big proponent since kind of getting into organizing of just not working in silos. We have to do this work together. We're all working for the community, and therefore we should all be working together, is big. And I think the more collaboratives we have, the better. And then, you know, taking even a step further to having representation from each collaborative to even come together, right? So just making sure that we all know who's doing what, and we're not duplicating services or energy and resources, and really being mindful of how we use our time.
From the CAHOOTS perspective of the work that we do in our community, I think we do a really great job of sharing the reality of the systems that we work within, which is like, you can have a police alternative all day, all night, literally, but the reality of like what we hold when we are just bringing people, literally picking them up at jail, to the shelter, to the hospitals, to these even alternative systems, I think we do a great job about like conveying that to other professionals, other nonprofits, like telling them we have the highest rate of homelessness in the country. And there's this really like passive acceptance that because we have this alternative program, if you just call CAHOOTS, like problem solved. And often like we are removing somebody from a neighborhood, and we might just be taking them to trespass in another neighborhood. So I think something that we are working on, especially in the last year, being put in this spotlight as a solution is making sure that we are bringing that reality in a different direction and using this platform for advocacy locally and nationally. So like, for instance, the CAHOOTS Act just passed, and that is funding for mobile crisis intervention, like kind of seed money. What ended up making it into that language is that the programs need to be staffed by clinicians, and that would actually disqualify CAHOOTS itself from getting funding from the CAHOOTS Act, because so distinctly in our model, we do not require licensing, higher education other than in our medic role. So I think with that knowledge, it's pushing us to like recognize the systems of power, and carrying also like information from the communities we serve, while also doing advocacy around like decriminalizing substances. There's a measure 110 in Oregon that passed on decriminalizing sleeping outside. There's a Right to Rest Act movement going on. So that is work that we are stepping into that I think we have failed over the decades that we have existed. Yeah, there's very much a belief that I think a lot of people enter this work of like, oh, I'll be an agent within the system and I can change the system by being radical or an alternative. And that is not how power and change works.
Thank you, Swift. Yeah, a lot to think about. And what you just said, so much. I think the first thing that comes to mind when I think of the question is really about what true allyship looks like, right? And what, you know, and that even, and I say that to say that I think that more traditional nonprofits, right? So, and that are part of the nonprofit industrial complex are in a position that they need to really think about being an ally in the movement. And I say that specifically when I say ally, I'm talking about true allyship addresses that power imbalance. True allyship acknowledges, right, that both your privilege and power and resources. True allyship is, it pushes the voices of the community first, and your advocacy when you're speaking on behalf of way back here, you know, secondary, tertiary, whatever it might be, right? So true allyship is about ensuring that who's heard and who's leading are the people that should be leading and the people that should be heard. And I think that in nonprofits, we have in the sort of traditional nonprofits, and when I say that, I'm talking about the folks that are funded by traditional funders, right? I'm folks that have budgets that exceed and can allow for, and should allow for fair pay and, you know, and living, not even just a living wage, a thriving wage, right? Folks that are, when you know, there's an acknowledgement that we have to have of where we sit in the, and as a part of a system, as a part of many, many systems. And one of the things that we can do really well, if we intentionally do it, is we can share resources and our voices can, and push our voices to the back. And so I think when there are grassroots organizations, when there are grassroots movements, that are truly doing the work and truly on the ground, which is all over our country. And honestly, that's how most of our nonprofits got started in the first place, right? Particularly in border violence, right? Or in sexual violence and as well. Then I think that we have an opportunity to really think about what collective liberation could look like. And we have an opportunity to reconsider what that power dynamic looks like, and to utilize our privilege, quite frankly, in order to share resources, in order to share knowledge. Like, you know, I think about, who do we fund? You know, who do we fund to do the work? Why do we hire folks to come into an organization to do the work when there are folks already doing the work, that have been doing the work, that have been doing the work, and been doing the work, right? And so I think that really questioning those systems and thinking twice about you know, the usual equation of A plus B equals C that we think about, and then systems is really important. So I hope that gets at your question, but that's what's coming up for me.
Thank you. I love this word opportunity as well. I think that's so important to uplift. Penny, would you like to add any thoughts to this question?
Yeah, I just want to say I really appreciate what everyone has been saying as well, and you know, addressing what I refer to as like oppressive dynamics, you know, that are very heavily, honestly, they're very heavily ingrained in these institutions. And I want to name that I myself and other people that I love have felt personally victimized by social workers, you know, and I'm sorry, that makes me maybe nervous to say, but there was actually something that came out a few days ago in Rochester, New York. A white social worker in Rochester, New York wrote about how social work is a white supremacist organization as well. And how so much of social work and the way that a lot of these care programs have been developed historically as institutions have been very predatory, you know, and violent and exploitative. And that's something that history has to be kind of reckoned with, I think, if we are going to embrace these alternatives. I know that we can, you know, find all the alternatives we can grab and put them in a huge pile, but if we're not really willing to look at our implicit biases and the way that we are carrying ourselves, yeah, I guess I just want to say that again, I don't have as many credentials as most of the people here, but that's something that, you know, working, I don't even like to use the word working because it's just a part of my survival, you know, and the survival of so many people I love, and we care for each other and we find ways to provide for one another when we can't depend on the system to do that with us, you know, and I just really like that has been named as well, as that people have been doing this for a very long time, a lot of mostly out of necessity, you know, and that just is so, it makes it so evident that the system just does not work for all of us, you know, and people do find ways to figure it out even when it doesn't. So human ingenuity and the ways that we work with one another is a beautiful thing. And I guess that's all I can say about that.
Thank you so much, Penny. Even if you were feeling nervous, I'm so glad you said that and that you named it. I'm seeing some appreciation in the chat as well. And I would like to also point out that even in saying that you have less credentials than others on this panel, that's part of what makes social work a white institution, right? The professionalization of care work and how, yeah, how that's part of this history. So thank you. We're gonna shift into our next question. Miriam Kaba says that the police live in our minds to such an extent that we aren't able to imagine a world without them or imagine alternatives that center accountability over punishment. How do you define success for programs that are alternatives to calling the police? And if you are part of such a program, has your program achieved this definition of success?
Part of our mission on CAHOOTS and part of our work in the field is moving through a CAHOOTS call with the least intervention necessary as the ultimate goal, understanding that even as an alternative, CAHOOTS by design is ingrained in the public safety system. So to access our services, you call a non-emergency public safety number. And that means that depending on some details of safety, weapons, whatever, that could warrant a co-response with police, or that could warrant a police response first or exclusively. So when I think about the model of our work, like we are attempting to mitigate the normalcy that police even have to be interacted with at all in what are generally not emergencies of safety, but an emergency of resources. This is like something I always say is there's no wait list for 911, and there's a wait list for every other service that would take care of somebody in a way that would prevent them from even having to access us. So when we are showing up, if I can at least transform that interaction, I'm not bringing someone to the hospital every time they're experiencing suicidal ideation, not bringing someone to a traditional doctor setting. How can I do wound care? This is where our medical piece comes in. Rarely are mental health and physical health disconnected. So ideally, we'd live in the world where people don't have to call police. Ideally, we'd live in a world where people didn't have to call CAHOOTS. And knowing that every time I put someone in the CAHOOTS van and put them in a sterile environment at the emergency room, I am reaffirming that that is the solution versus empowering people to like look for their natural and social supports and programs that I really believe in the community, which are increasingly radical and like my friends and grassroots and this resistance work. And that for me is something that has held over all of these decades of this work, but I think is like really, really reframed in like the reality of now, just to say that. So yeah, that's how I determine success again, kind of an individual person-to-person encounter. In terms of like a greater success, again, like ultimate diversion for us is like, how do we divert from the police, the fire department, jail, hospital, but ideally uplifting communities to operate without those things as much as possible.
Yeah, thanks, Swifte. I wanted to follow you because, you know, so much of our Treatment Not Trauma campaign is pulled from the CAHOOTS model, right? We've seen it work. And so in Chicago, we're seeing it as in terms of a public health crisis. We want to pull the funding for a non-police crisis response and make it a mental health thing and pull it away, particularly from police, just because simply in the city of Chicago, police presence, it just equals escalation historically. And we're really trying to remove the lethality of it all, right? Like people are dying for having mental health crisis because the first responder is a police officer. And what we want in our response, it to be also a mental health practitioner and a paramedic, same kind of model, but not associated with at all with the police department. Same kind of concept of having a different phone number to call for these crises so that this team is the one that comes connected directly with the Department of Public Health and the mental health centers so that there's a streamline to those services, right? That person is then, making the drive to, albeit an emergency room, a shelter, whatever the case may be. And we're looking at responding to not just mental health crisis, but we're thinking about, and it's as simple as petty theft, shoplifting, these kinds of things, where even in those situations, those cases have escalated to the point of death because of the lack of training and understanding of the situation that individual is in. And so we want to make sure that we remove that particularly armed presence in these situations. And I think we view our proposal is up. It's on the mayor's desk now. So I think it's definitely in her hands. But I think the success that we would see, the success we hope to find is that people live longer and people trust in the fact that their health can be somebody's priority. Their well-being is somebody's priority, and they feel safe enough to call. And mental health equity in Chicago is just terrible, right? Like three quarters of the city has less than one therapist per 1,000 community residents, right? So we need to work on that. And that's why we want to definitely empower the public health sector to really include those mental health aspects. And in terms of having those wraparound services, success would just be less deaths. Unfortunately, that's where our bar is right now. And that's what we're hoping for is less deaths, more services, and just more safety to help themselves. And that trust in a system that is just flawed right now. It's just people completely distrust CPD, and we want to definitely have people regain that connection again.
I just love hearing about all of these alternatives that are being created in different places and everything. And I just thank you all for letting me be here to witness this. Something that I think CAT 911, especially within our sexual and interpersonal violence sector, I think we just kind of try to create a space away from, or create an alternative space for folks who don't want to deal with a quote unquote mandated reporter. And so, okay, so, and I know like those, options, may be important for some folks, and I'm not trying to discount them at all, but we want to create, a space for folks to be able to call and share what they're going through and find maybe resources outside of a system that may or may not criminalize them or put them in a situation where they or their children are harmed, and so there are a lot of things that have to do with that. The carceral system is so insidious, and there are undocumented people who experience interpersonal violence and sexual violence, and they can't go to somebody who would be a mandated reporter because that would involve them directly into the carceral system. And I also am coming from a place where I understand that when you are a mandated reporter, you have to do what you have to do sometimes, and that's why we try to it's really, really difficult, and it's not perfect, but we just try to establish that kind of hope that there can be alternatives, and maybe we can figure out ways to deal with these things in our communities, in the same way we have been, to make it safe for everyone.
Thank you, Penny, Swifte, and Vero. So I think success. So one, VAWA actually, for intimate partner violence, or VAWA actually should be it limits mandated reporting. So while you have to think about your state and the state regulations wherever you are, so I'm in California, and VAWA actually really limits who is actually a mandated reporter. And if you're a licensed clinical social worker, that's a different story, right? Of course. But it should limit it, and it limits it for survivors for a reason, right? It limits it because it is, we know that those systems are intentionally, honestly, harmful to families and survivors and communities at large. So, I think when I think about success, there's so many ways that success can be measured, and also just the measuring of success in and of itself is a white supremacy system, as part of a white supremacy culture, the way we think about it, and particularly how we have to do it for funding, right? So But when I think about success, I think about the hotlines that are not associated with law enforcement. I think about the domestic violence hotlines across the country and in your own communities, wherever that is, that are not associated with law enforcement. They might have relationships, but they're not a part of it. They're not actually, they're a separate nonprofit or a separate system. I think about success would mean that those systems didn't, those systems, and I am calling them system, right? The domestic violence programs, which I came up in, ran, used, so, you know, as someone like the course of my life, I would consider it a success if we could get those programs to have other options and refer somewhere else besides just law enforcement. So many of our domestic violence programs refer directly only to law enforcement. Some of that is contract related, but some of it's not. A lot of it actually is not. There is a lack of understanding and resources. There is a helping savior mentality that we perpetuate and in our training and in our upbringing of what advocacy really looks like, that says that we need to have the answer on the other end of that line, that says that we need to have, and so then I think that often we reach for answers that are not helpful, or that often we don't even know what's going, you know, that we have no idea. We're sending someone into an abyss, right, of multiple systems. And I think that I would really consider success as shifting that paradigm for the thousands and thousands of people. So in California, in the organization that, the last organization that I worked with, we could receive tens of thousands of phone calls of pure life or death related phone calls from survivors a year. And we served one in California, works so different, I think, than some places throughout the state, but in serving one county in California, right? So it is, we saw, and in doing so, the percentage of folks, we started measuring and asking, percentage of folks that actually wanted law enforcement as a part of their intervention, as a part of their wraparound, as a part of their support, whatever it is, they would not, was so minimal. And yet advocates inside that system feel and felt that they had no alternative to actually to offer, that they needed to have an option. And I think that they needed to give somebody something, and they wanted someone to show up, and someone to show up for this family. And this is before COVID, right? So I'm not talking about because we were worried about the virus. I'm not talking about those kinds of things. Where we're all in the land of Zoom and still trying to figure out how to do things safely from that level. But I think that I would consider success is if we could shift the systems that are already there, the way I looked at it is, if folks wanted law enforcement, they only had to dial 3 numbers to call them. They dialed our entire hotline, right? So if they dialed our entire hotline, found us some way, in that capacity, potentially had to look us up and find us, right? They are already asking for an alternative. So what are we going to be able to do? So I think so I'll stop talking.
I wanted to hear what you were about to say.
I just feel like I could yell about this all day long. I feel like if we're truly successful, then we are building and rethinking what response means and what it looks like when folks are calling, all of those digits, when they're calling 7+ digits to reach us in the first place. And I think that also means that we're taking into their needs and their story into real consideration. And I just think there's a lot of disrespect that's built in to us then turning around and referring them back into a system that they are intentionally not calling in the first place. So.
Thank you so much. I'm feeling inspired and want to ask a question around community resources. Both Swifte and Colsaria have mentioned this. For DV advocates, how can we build up our understanding of the resources that are currently available to their local community that are alternatives to the system? And how can DV advocates help bolster those community resources?
I think kind of coming from a place of learning right now as we navigate what the impact that this program can have. And we are a group of people who are just so geeked out about knowing how successful it's going to be. We're also starting to look at what the groundwork is going to look like, right? How do we inform people? We're going to have to do canvassing. We're going to have to do all of this, but it's going to really fall just, I mean, one of the best things that I think the DV hotline did was like those little chapsticks that have the number on it, right? Like these kind of ways that we can just get things out to people that will give them just brief bits of information that they can access without having to proselytize or, you know, have to sit there and explain a whole program, but really about anybody who's within our reach, having that information, emergency rooms, to, you know, shelters, all of these places that can have access to these services. We need to do better at being more informative to folks. And I'm hearing what my other panelists are saying and my peers, right? Like we put so much work and onus on the client to do this. And we have so much power right now to get to them and really making sure that we're maximizing our reach with all the capacities that we have. And so anybody, doctors' offices, clinics, right? We have this information available to them. And then I think also trusting in the power of community and how information spreads within the community. But it has to be good information, good, solid information for it to share and not kind of like, oh, I heard that there might be this thing. No, we want to be sure that it's good, solid information that's being shared. And we're not just sharing, being a part of the misinformation campaign. I think that's really important.
Oh my God, so many thoughts about that because like my own therapist's voicemail says, call CAHOOTS if you're in crisis, right? Like, and we are like, again, kind of this like misnomer solution. The entire nonprofit system in my area relies on heavily. And especially in the last year, like I had to face kind of this like ethical fatigue, this like resentment for like service providers who got to close up shop, work from home, keep their families safe, keep their bodies safe. And meanwhile, like we altered nothing about our services besides PPE. And yeah, another thing that I think about so much in this work that like just is so complicated, and again, not the solution, is like, what number does somebody's phone call when they have no minutes? What's the only number that people can call? 911. Who runs out of minutes? Poor people. People in like working lower class people who are continually disproportionately affected by oppression, lack of income. And so that got really crystallized for me in the last year as resources that are so limited became like literally woke up one day, nothing was available in my community in the way that it was the day before because everyone worked from home, and that included our local DV and sexual assault services that no longer were seeing people in person for a very long time. The SA advocates are no longer going to emergency rooms to be with people during exams if they elected that, and that is something that like CAHOOTS helps navigate very frequently and ideally most of the time when we can respond to those calls in our community. But then I'm handing this off to what is now like my tools that I used to be able to say, like, here's how it's going to go. Like, they have nurses that I trust. I've worked, I've passed care in this ER. I love this nurse, like being able to share that reality, like, but then having to share, and this really powerful part of what could have made this go better doesn't exist right now is really challenging. I love what you said. I refuse to give people referrals, like, so much of the time. Like, we have a binder this thick of pamphlets. I do not believe in them. And again, think so much of my work is like, if I can say not just like, oh, call this treatment center, if I can say, call this treatment center, make sure you get so-and-so on the phone, call between 9 and 11, they're on lunch break at 12, like, you need to get this intake at this time. And can I help you with like one of those pieces? Because I also like operating under a harm reduction lens. I can't work harder than the person themselves, but I can tell them like what is up every step of the way. And that as a provider is what I prioritize heavily.
I just really want to like highlight that the work you're doing with, telling somebody like when to call and everything like that, like that's all about accessibility. And like, I think if we prioritize accessibility for folks and like really like think about that and have that at the forefront of, what we're doing, and talking about the ways in which folks are disenfranchised because of accessibility or non-accessibility, that's so important. And I think it just sometimes gets really lost in like what we're doing every single day. And I just really appreciate that that was like specifically named, because that's so important. And I think with that, like, I think folks who experience intimate partner violence, most of them are incarcerated currently. And we can ask those folks, how did the system not provide you with what you needed in the situations you were in, and really like looking at that, really looking at the ways in which folks are disenfranchised every single day and put in situations where they have to endure these situations. That's going to really lead us to the place where we focus on what access people really have. And community-led, projects are so important for that. Having people in the community who are experiencing these things be a part of the planning is so important. Yeah, peer-led solutions, and, folks who have experienced, drug use, working with drug users, folks who have experienced intimate partner violence, working with folks who are experiencing intimate partner violence, right? Focusing on lived experience and peer support, I think, is really going to be the best way for us to provide things comprehensively and accessibility.
Thank you. Well, I when I look at this question, like, I wish I had an easy answer, but the answer I'm going to give is not. It's not easy. So it's going to take. It takes time. It takes work. I would suggest that domestic violence advocates get to know their community leaders. It's not. Doesn't take time. I mean, it's going to take lots of time. It takes lots of work. But I also know that once you're connected and once you know them and you trust them and they trust you, you will have the resources you need. You will know when stuff changes. You will also be in tune to listen to the community in a different way. There are people, as Penny, you talk so well about, there are people who have been doing this work for generations and have never been paid. There are people that are doing the work out of, out of their van, out of their house, out of their whatever, like in there, for just showing up because their community needs it. And they've been doing it for a really long time. And so I would say you need to get to know them. Whatever community you're serving, know who they are. And I mean, and quite frankly, like, I feel like we need to sit at their feet a little bit. We need to give reverence where reverence is due, and we need to shut up and listen. So I think that when that is when you know them, when you are in tune in that kind of way, and where you are connected, and you can and know what you offer when you go. I mean, for sure, know what you offer too, right? Like, don't expect people, particularly like, don't expect BIPOC people, LGBTQ people, whatever community don't expect people to give you something for free, but know and get to know people, right? Like, that is the closest way that I can say is to be connected. And community leaders look a lot, they are in a lot of different places in a lot of different ways. Know where, who's doing the grassroots work, right? And they may not have DV next to anything that they do. And that does not mean that is not remotely a huge part of what they do, right? So they could be in churches, they could be in synagogues, they could be in, they could be working on immigrants' rights campaigns. They could be, there's so many places to be looking for community leaders, but that is, again, it's not an easy answer. There is no handbook. There's no online website that you can go to get the right to know that you, right? There's no resource guide, right? It's like the intern joke, go create a resource guide. But so I that would be my recommendation.
And if I could just add to that, right, in terms of what you're saying, in terms of talking to community members, community leaders, is I've also learned what community leaders are not providing trauma-informed support and services or even advice, right? So I know as I've started talking about community leaders, particularly in the faith-based system, like when it comes to intimate partner violence, you start to learn which ones might be a part of the problem as well. So you get to be, while meeting community leaders, you get to also be a change agent and educate and inform others of their practice. So it's really like a double, triple whammy as you get to meet community leaders, because they may not know that what they're doing is more harmful. And I've had some really difficult conversations with community leaders about how they present information, and that you could just be ostracizing people even more. You could be harming them more, traumatizing them more. I think Penny has brought a lot to the table and has said things to us today that might, some of us, might be hearing for the first time. I'm not hearing it for the first time. And I've said this to people. And I think when you meet those other community leaders, you have that opportunity to be like, yo, I wouldn't have done it that way, right? Like you might have more reach if you do it this way. So it is a double kind of triple whammy when you do that.
Thank you. Vero and Colsaria, I'm hearing an underlying theme of reciprocity and being in right relation with each other. And I think that's so important. I think one of the values of white supremacy is dominating others. It's extracting resources, exploitation. And one of the lessons, a big book that has given me a lot of insight into being in right relation with others and reciprocity is the book Braiding Sweetgrass, Indigenous Wisdom, Scientific Knowledge, and the Teachings of Plants. And it's by Robin Wall Kimmerer. So I wanted to uplift that. Let's do another question. For these programs, what does training look like for folks who are responding to a domestic violence crisis versus a mental health crisis? And is there a difference?
Wow, great question. Great question. It's a tricky question. But I think when we're looking at this, they have a lot of similarities, right? I think to the outsider, they might be one and the same. But one, I want to be very careful because I mean, power and control can be a part of both. In a mental health crisis affects, right, a system, and whoever is in that crisis it's obviously a part of a system, and perhaps even further outside systems. And while domestic violence is such an you have to, your intervention is very careful because we're talking about safety and how that individual creates safety for themselves. And I feel like my conversations have looked different when I'm working with somebody who is experiencing a DV crisis versus a mental health crisis. Mental health is just so much of what I'm experiencing, and then how others experience what I'm experiencing. And DV is pretty much what that person's experiencing and how it's affecting me. You know, they're just kind of a little different in that aspect, but you're wearing the same lens. It's a trauma lens. You have to have a trauma lens when it comes to working with both DV and mental health. And with that lens and through that training, the more trauma training you do, the better. I learned, unfortunately, like full disclosure, that without proper DV training, I wasn't providing enough support to my clients in their mental health crisis because I didn't have enough understanding about power and control dynamics to be the person that they needed me to be. So I am a huge advocate now moving forward for everyone to have that DV training to understand those components, because you can then create more harm for somebody in a DV situation if you're not well trained. You could then become an abuser, not unknowingly and obviously in a benevolent way, but you can be a part of the power and control if you're not careful and well educated. Because I think that there are different dynamics at play when it comes to it. So basically, I'm just saying is if you want to work with those in the DV intimate partner relations things, you have to have that training background, because you may unintentionally create more harm for an individual in an unsafe situation.
I really like that there's like a differentiation in this and everything, because I think that the way that I view this is every single circumstance is going to be different anyway, right? So we have to like focus on the access needs in that situation. And I think, you know, when somebody is experiencing intimate partner violence, they're dealing with a mental health crisis right there. And it's like a certain kind, right? That's just a certain kind of mental health crisis. And there are so many different kinds of mental health crisis that can happen. So us looking at it in a way that, you know, we have to take intersectionality into account. You know, what situations is this person in because of their circumstances historically, right? Like there has to be less of an emphasis, I think, on you know, sticking to a specific protocol, and more of an emphasis on looking at each situation as an individual situation and grabbing the tools that we have to cater to specific access needs of that situation. I don't know if any of that makes sense, but that's what I would say about that.
So I would just quickly add that I think that the dynamics in a family and in a relationship, while those things can show up in mental health for sure, I think it often looks a little differently in intimate partner violence. And I think where the risk So it just really resonates with what you said, Vero, about getting enough training around the dynamics, because I think that if you don't understand the dynamics that can occur in an intimate partner violence situation or a DV situation, and I say situation, but it's not a situation, it's right, like, and it's not an individual situation at all, right? Power control doesn't work that way. And so because of that, I think it's really important that folks do have some training in those dynamics so that they can, one, recognize that there's other things at play, right? And I also think that so much, there's so much outside of that physical violence, so much outside of the physical violence. In fact, the majority of it is outside of the physical violence, right? And because of that, if you don't understand how those dynamics work, then you don't understand decision-making, then you don't understand what questions to even ask for someone to ask themselves to help think about what safety might be and what safety might look like 10 minutes from now, not talking to you, right? And how that can change and shift literally in that 10 minutes or 10 seconds. And so I think without the training and around the dynamics, and now who does your training and all of that, that's a bigger, broader, that's a different story. But because all trainings are not equal. So I'm just gonna, all trainings are not equal. But who do, you know, I think it is really important to understand, in order for you to really understand the power dynamics that are at play that somebody has to think about in those situations, and when they're sitting in that, when they're breathing that air, quite frankly. So.
I'm going to try to narrow my thoughts, but something that is coming up is when I think about the step before, maybe even CAHOOTS responds to a call. This comes up a lot. Like, I've been at conferences, I've been interviewed about our work where, like, for, I don't know, for lack of a better term, for whatever reason right now, like police and like individual officers always cite domestic violence calls as like, how could CAHOOTS respond to that sort of thing? And it's like a really like perverse, like almost like, yeah, just that idea, that saviorism, that thinking of like women being the victims and cops being this like obvious patriarchal power that can show up, and yeah, how to like stuff changes in 10 minutes, just like biologically our bodies get ramped and we come back down, and then like cortisol is released and we're tired. Like, that situation can change from the 911 call to like the response time. And so I'm thinking about even just the training of like dispatchers and call takers, like when they hear those words, what comes up for them versus when they hear a mental health crisis, or like thinking about that when they hear like, oh, I'm being abused by my partner, but it's somebody living outside in a camp, that's going to get a CAHOOTS response. Somebody is in the South Hills and they're like nice, rich neighborhood, that's going to get a police response, potentially with the same exact details. And then when I think of us showing up on scene, I think, you know, mental health crisis is often more explicitly stated as the reason that we are responding versus like domestic violence, power and control. Like, that is something that we might have to take a lot of time like looking for, and we might not show up and say like, hi, I'm Chelsea, I'm a crisis worker with CAHOOTS, I'm here to talk about your abuse today. You know what I mean? Like, that might be spending a lot of time just like talking about your family, like sitting there with your children, like having if I'm the counselor that day, like my medic partner might be sitting across the room, like literally playing with toys with the family and just building that comfort and trust. And I'm not saying it for people, but trying to use like reflecting back what we see in our knowledge of the system that might be helpful, that might lead us into a more direct conversation on, and potentially unrelated, but something I just want to bring up, which is something that we do look out for because of how our model exists, is that we can have people manipulate our service by requesting welfare checks for people, and that we have to be like, really, like, I trust my instincts around this all the time, where if it doesn't feel right, like you know, so-and-so is requesting a welfare check on someone and they haven't spoken in a year, I'm like, no, that's them fact finding, that's them like trying to confirm an address, that's them trying to like define that this person needs help. So that's something that like kind of really, particularly in our work, that I try to really share when I train new folks who join our team. And our training is largely like in a team of 3 for like 6 months, you're training and taking it all in before, you know, versus at other nonprofit jobs, I might have been training for a couple weeks before I'd be having those direct conversations alone.
Thank you. I believe this will be the last question. We're almost at time. Put it in the chat now. For these alternative programs, that should say how was the vision created? / was there a struggle to create a practical and visionary structure? And who inspired it? Whose work inspired it?
So I'm going to jump in again. That silence is killing me, y'all. I think that for us, the biggest catalyst was the closure of 6 mental health hospitals in the city of Chicago about 8 years ago. Our previous mayor closed them down for funding purposes, and the influx of response, 911 responses to mental health crisis. And obviously and then there was an increase of arrests. So there's, you know, Cook County Jail is like the biggest mental health hospital in the country, right? I mean, it's just, it's where these cases are going, right? And we just saw these patterns developing, all from the closure of such an important resource. And then, you know, that inequity to mental health. Well, what happens is that when your mental health needs aren't met on a regular basis, you only intervene when the crisis happens. You only receive an intervention when crisis hits. And we saw that pattern going skyrocketing since the closure of those mental health hospitals. And so within our collaborative, right, we started looking at what the alternatives were. And again, you know, CAHOOTS was a big one that we kept coming to mind, like, how can we stop this incarceration of people in mental health crisis? Like we just honestly believed as a cohort that this could not be a reality, right? Like we could live without these interventionist police officers, and really thinking about meeting the needs of folks who have just been ignored for so long. It was just something that I think as most of us are mental health practitioners or involved in that area, we're just fed up. And it was a huge catalyst to say we've got to do something, and really opened our eyes. And we did some research, and Dr. Arturo Carrillo did a lot of research within the city about looking at inequities. You know, he's the one that came up within his research of that 0.2 therapists per 1,000 residents in 2/3 of the city, right? Like, that's a big number, and that's something that we have to be concerned with, and everybody should be concerned about. inequity was our biggest catalyst in this work. And it continues to be our vision, is that mental health should be a health response, right? It should be health, not just mental health. It shouldn't be mental health and health in dentistry. It should just be health. It should just be one body, one response. So that's us.
I have an answer, and I will say I would have like an answer that would be 5 times as long. That would be a critique of this answer and how I contextualize it and my interpretation of the work, but we have 3 minutes left. So White Bird Clinic started in the 60s. And for me, it's like, I look at like our work was very similar to the work of like the Black Panthers, Young Lords, and those programs do not exist anymore because of heavy criminalization of those folks providing similar services. White Bird then started getting legitimizing funding, and as that still exists. So that being said, our work was to serve like disenfranchised youth who were drug users on the street, who were falling through the cracks at a time where like drug use was drug treatment was not specifically funded. It was looked at this like alcohol lens and so our services started off as a crisis center for folks to come to, and then looking at that population, what were they not getting? White Bird Clinic then developed a dental program, counseling, medical clinic. So did build out based on the needs of the population. And then CAHOOTS was born out of the crisis clinic, has for 52 years run this phone line, and folks, due to accessibility, were accessing the phone line as not just crisis, but as an ongoing mental health therapist, like a friend, everything. So CAHOOTS was like, well, what happens if we go meet people out in the community and increase those connections? So in that sense, based in our own culture and work that we did, it came practically pretty easy. And then got real interesting when the police approached us in 1989 and said, we have funding for community policing that we would like to give to you all. So I empower other communities looking at this model. It's not just about this model, it's finding the White Bird Clinic, the groups in your town that might be nothing like White Bird Clinic that could fill that role. It's not just about the model, it's about who's doing it and the trust that the community has with those people.
Penny, do you have any insight about how CAT 911 has their vision?
Well, we just started, so we don't have like as much to say probably in terms of that, but you know, I think it sorry I think really this was in a response to the pandemic and a lot of folks being at home with the people who are causing them harm, you know. So yeah, I mean, that's really as simple as it gets. CAT 911 in general is just an organization trying to provide those resources to the community free of charge with an abolitionist framework. And we're building as we're going, and we're seeing the needs as we go, and trying to figure out how, you know, we can utilize every avenue to provide resources to our community.
Thank you. And then Colsaria, I want to give you space to have any commentary on this question, although I know you're not a part of a program yourself.
I mean, I know my interest in alternatives came from supporting multiple survivors that died. It came from survivors that had police interaction that created so much chaos in their lives and actually created and added and expanded on the physical violence that left them either to take their own lives or to be killed by their partner or ex-partner. or several of them. My interest in alternatives comes from my own story of watching the police beat my father as a child for a broken headlight. I'm from the South. And watching that take place and being very clear about who has the power and authority and what and who is and who you really call if you need help. And it wasn't law enforcement. And so I think I come to this space from a place that I think where domestic violence programs can intentionally look at separating themselves from systems that don't necessarily support a huge chunk of the folks that we serve, that we work, and we are frankly accountable to. I think that our communities demand and always have demanded alternatives. And I think that we need to, it's a beautiful time in some ways, because I think that we are finally at the point where either people are desperate enough or people are pissed enough, and either works for me, that we can no longer discount the fact that there's not, we cannot say that there's one way to do this. Because that is actually how we lose people. That is how people die, quite frankly. And I'm tired of communities dying. I'm tired of my community dying. I'm tired of watching it happen. And I'm tired of my loved ones being killed.
Thank you. Whew. This was really great. We're a little over time, so I'm just going to give a lot of thanks to Vero. Thank you, Swifte. Thank you, Penny. Thank you, Colsaria. I really appreciate hearing everyone's insight from your various backgrounds, and I'm really happy with the conversation. We're going to go ahead and end now. Bye, everyone.
Thank you.